40. 33 years lady complains of the severe left radicular pain following a trauma 2 years back. Intermittently with conservative treatment she was fine, okay, but for last 3 months there is no conservative treatment works. There is not so huge disc, there is a small disc only at L4-L5 level, left side. So when the all conservative treatment fails, patient is having pain, scoliosis, limping, small disc at left side L4-L5. We are approaching from the left side. This is the spinous process here, superior lamina, inferior lamina, this is the facet. So cranial, caudal, midline and lateral. This is the first bite we are trying to take at the spinolaminar junction with the 3 mm Kerrison punch with side to side movement or the wiping movement. We are just trying to introduce the 3 mm Kerrison punch, 45 degree, first bite at the spinolaminar junction, and this is to detach the yellow ligament or flavum. Now flavum is detached at the spinolaminar junction. Gradually we are coming laterally. Gradually we are coming laterally and trying to detach the ligamentum flavum here. This is the area, this is the superior lateral aspect, the flavum it is attached most cranially here. Now discuss. Now we will remove the superficial layer which is already detached from cranially and caudally, and this is the superficial layer of the ligamentum flavum. Superficial layer of the ligamentum flavum. Now 45. We will try to detach the ligamentum flavum caudally from the inferior lamina, from the caudal lamina here. So I am removing this is the superficial layer now. Then the demarcation of the superficial to the deep layer is clear, and at the same time the superficial layer, the deep layer attachment to the inferior lamina is also clear. Now I will try to negotiate my Kerrison here to detach the ligamentum flavum from the inferior lamina here. So this is the area where the nerve root enter into the foramen. So we are just trying to detach now 30. So we'll put a cranial patty, another is a caudal patty, Okay. So this is the caudal petty, and now we'll detach this ligamentum flavum from the midline, the 11 number blade. So detach the ligamentum flavum from the midline with the 11 number blade. Now spatula or pen field. Now this is my nerve root here, and this is the cranial petty, this is an caudal petty. Let's see we are able to see the disc space or not. Oh, Nina, L5S1 if it is L5S1, it would have been easy to approach the shoulder of the nerve root without removing of this flap of the ligamentum flavum. Now we have to remove it because we are not able to see the shoulder where to approach the disc. So in another case, maybe in the L5S1 we will try again. This is the L4-L5 level. So we have to decompress the nerve root. Now we are at the lateral recess. We are at the shoulder of the nerve root. So we have to decompress the nerve root. This is the SAP, the superior articular process of the inferior vertebra. That is the these are the ligamentum flavum, and this is the SAP. This is the hypertrophic portions of the SAP. We have to remove this portion, otherwise you can't decompress the nerve root up to the foramen. So we need to negotiate gently over the nerve root. Disc force. Maybe the conjoint root. That's why we could not. आमे ई जगह पछे चेष्टा करथले नटाटी दिले असुविधा होता this person. So maybe this is the conjoint root, spatula. So this is the axilla, this is the first nerve, and this is the second nerve. This is the conjoint root or Furcan root. This petty. Now we will put a petty at the shoulder of the nerve root. This is the Furcan root. Two nerve root at the L5. S1 is a common, but L4, L5 it is very, very rare. This is the disc below. Okay. Now disc forceps. Now reposition of this petty to the shoulder of the nerve root. Look out, L45. So this is the bone is coming on the my suction tip. So I'm just trimming 1 millimeter of the bone for fine trajectory cutting. These are the epidural vein, which is engorged more than 2 years now. Okay. Spatula. चश्मा देल एबे देख यहाँ को गोटे पल्सेसन देखा धक धक हो जानी ता तलू बाहर नर्व यहाँ नर्व यहाँ गोड़ को जाऊँ या तले डिस्टा बस यहाँ चिपुच यहाँ काढ़ीदे यहाँ फ्री हो टाइट अच्छे से So this is the nerve retractor, which is protecting the nerve, pushing medially, and then I am putting my 11 number blade. Yep. Outer nerve है, this is 11 number. So the nerve root retractor was protecting my nerve root, and that pushed medially. Then I am creating a crisscross type of incision at the annulus, and this is my cut end of the annulus. Now below that is the disc. So we have to decompress the disc material. It is in the pressure, it is coming automatically, and that is the cause of the pain. Now I am going towards the foramen of the, these are the all free fragments at the foramen. I have just reversed my disc forceps and going towards the foramen. So foramen is now clear, looks like clear. So now almost clear. We will see inside the disc space if there will be any free fragment left out. We will try to remove. So clear now, no more free fragment, everything free. Irrigation. Now we will irrigate the disc space with normal saline and gentamicin. So this is the normal saline with gentamicin. If there will be any small tiny free fragment will be inside, it will automatically push out with the help of the water. Disc or step. So now we'll remove the petty. ଏବେ ଦେଖିପାରିଲ ନା କ୍ଲିଅର ଏଇଟା ହେଲା ନର୍ଭ ରୁଟ୍ ଏଇଟା ପୁରା ଚିପିକି ଥିଲା ଏବେ ପୁରା ଫ୍ରି ହେଇଗଲା ପୁରା ଫ୍ରି ଦେଖିଲ ବୁଝିଗଲା ଚलो थैंक यू दे दे जेल फोम आर पेशेंट को डकईकरी तार प्रॉन पोजिशन आम जमी टिलिप करूँ से पोजिशन कर से पोजिशन आम डिकम्प्रेशन करवा दे दे चलो थैंक यू the amount of the disc we have removed